PNET, primitive neuroectodermal tumor, is a very rare tumor, which is seen in usually young adults. And thoracic PNET is rarer than the abdominal PNET or the PNET of the other organs. Thoracic PNET arises just usually around the costovertebral angle, and its proliferation rate is very high. And usually it is diagnosed in young adults or some middle-aged men. And also, since it is a very aggressive tumor, many studies clearly showed that the treatment should include all the treatment modalities, including radiotherapy, chemotherapy, and also surgical therapy. We recorded a series of patients from two institutions, reference institutions in Istanbul, and we recorded all the patients during the 20 years, and we looked at the survival rates and the treatment modalities and their effects on survival. And we have found that, first of all, neoadjuvant chemoradiotherapy should be implemented in all patients, because neoadjuvant chemoradiotherapy was found to be associated with better survival. In practice, we have seen that the patients who had chemoradiotherapy before surgical therapy can have complete resection. In almost all patients, a complete resection was possible in these patients. Also, we looked at any possible prognostic factor in these patients, because fundamentally it behaves like a sarcoma. It is like a sarcoma. For this reason, there is no established staging system for these tumors. And we looked at some of the features of the tumors, and we have found that size could be a prognostic factor. And the patients with a tumor smaller than 8 centimeters had a higher survival rate compared to the patients, to that of patients with larger tumors. So in conclusion, we have concluded that, first of all, these patients should be carefully evaluated for possible surgical therapy. Secondly, the patients should have chemoradiotherapy. And also the patients, we have known that right now, the patients with smaller tumors, smaller than 8 centimeters, can survive longer. But also we have observed that the patients with larger than 8 centimeters of tumor can respond to chemoradiotherapy. And by downstage, if these tumors can be downstaged, the patients can have very promising survival rate. So multimodality treatment is a must in these patients. When we looked at the patients who underwent upfront surgery, we have found that the survival rate, the mean survival rate, is around only 20 months. But in the patients who had chemoradiotherapy, the mean survival rate can be as high as 70 months. And most of the patients with smaller tumors can have long-term survival, like 10-year survival. So these were our conclusions for these kind of patients.